Hello, everyone. My name is Berenice Tifu, an IT personnel from eBay's Africa. Today, I'll be sharing with you how AI helps make sense of Africa's health decision-making ecosystem. I would first of all like to say that this work built on Holger Schumann's paper, which is from fragmentation to synergy, and it's based off the theory of everything. Okay, so in our health systems, decision making often feels chaotic as it has to go through a number of factors or actors rather. And before a decision is being taken, you have all these disparities in conclusions and so forth. So uh, we wanted to see if AI could help us make sense of this complexity and using a comparison of three countries, South Africa, Cameroon, and Nigeria, to help us come out with a site to begin with. So our main aim was to compare how decision making using these three countries as a viewpoint and the theory of everything as a guiding framework, and importantly, to test whether AI could help us see things more clearly, as Elia said. And we had various sources of data, policy documents, health technology assessment reports, systematic reviews, and so much more. And also, our next step was mapping these actors to shape AI so that we can use it to shape our AI prompts in order for the AI to fully understand what we are looking for. So we saw that some of these actors included the government, um, private institutions, health regulatory bodies, the health system of each of these countries. We had the decision making partners and so forth. And for this, we saw that we analyzed the documents provided with natural language programs and specifically LLM prompts to map the theory of everything across these countries and bring out how the different health systems align with the theory of everything. The AI highlighted sub-ecosystems within each country decisions making process. We saw some communication between actors. So they weren't really working in silos, but you could also clearly see that there was not 100% communication between each of these actors. Through our findings, we also saw the evidence of collaboration, as earlier said, but it is still not at 100. Though I would say points to Africa, we are moving forward. The key finding is that AI helped us turn fragmented oversight into a clearer map. So from here, you can see the work of the AI in this. From specifying all these actors, we're able to prompt our AIs to be able to tell us or see the patterns of communication of working pipelines in each of these countries. And we can see in an example here of the various sub-ecosystems amongst the ones we already noted ourselves that AI brought out for us with Nigeria, Cameroon, and South Africa, where you can see through these black arrows interconnecting the different working bodies. I will give an example for that from uh, Cameroon, where you see guideline developers talking directly with systematic reviews or evidence-informed policymakers having straight conversations with health technology assessments, or in South Africa, where you have communication straight up between the private sector and the Health Research Institute, the governmental bodies and medical schemes, they do talk all round, but at the same time, they do not have a main hub of communication either. So, in conclusion, I would say AI is more than a tool for data crunching. It's a lens for a better view of how African health decision making actually works, bringing order to complexities. The potential of technology in health is way, way broad. And I feel on a personal level that we have not fully exploited this part of it yet. But this is something I would say your AI is as smart as you, or is as smart as you want to make it to be. For example, the AI I use for research most of the times, if you go through the prompts, you feel like you're talking directly to me. But of which that is not the case because I have been feeding it prompts and therefore it has AI is a learning language. It learns. So it has learned my way of speaking. The same way if you were to go through anyone's AI and use it, it will feel like you're talking to that person directly because AI has learned prompts of that person in specifics. So I feel like the tech has a lot to do and a lot to provide us with. We just have to use it in a controlled method and know that we still have some work to do before it can finalize any other thing for you. Okay. It also presents opportunities to strengthen the evidence policy nexus by enhancing evidence synthesis, building capacity and decision making in fragmented health systems. So it can connect all these other parties that are not in synergy, I would say, bringing it from fragmentation into clarity. So for recommendations, it's simple. Let us use AI to strengthen evidence synthesis, build capacity, and improve decision making in fragmented systems. With AI, we can use guided practice to enhance, support, and improve our health decision making systems in Africa, which also falls in line with Africa's EIDMs. And lastly, adapt to local context for better health outcomes in Africa. Thank you for your time. I look forward to your questions and any conversations on how AI can continue to shape the health decision-making system in Africa. Thank you once more.